surprised the hotline is blowing up with folks who are about to be eligible for the vaccine.
NBC 15's Rachel Wilkerson joins us now to explain. Rachel?
Kim McGregor, the Mobile County Health Department, said we are moving to phase 1B ahead of schedule because a lot of healthcare workers declined the vaccine. Many are confused as to who is eligible and why. Here are those now eligible for the vaccine: persons 75 years and older, frontline workers including first responders, corrections officers, U.S. Postal Service workers, grocery store workers, school and daycare employees, public transit, and manufacturing workers. It also includes those in group homes, homeless shelters, jails, and prisons.
It's really based on an assessment of risk around COVID-19. So individuals that are most at risk for being infected.
Some viewers have reached out with concerns over particular groups, such as jails, getting the vaccine over other senior citizens. Dr. Scott Chavers with the Mobile County Health Department says confined spaces have greater risks of major outbreaks, and that's why they are scheduled ahead of the general public.
Our youth homes, our prisons, our jails, etc., those become very closed systems that are easy environments over which the virus that causes COVID-19 can spread. What that means to us is those institutions can become nodes for transmission back into the general population.
Trey Oliver is the warden for Mobile County Metro Jail. He says his staff isn't considered first responders, but are essential to the public.
And they are working in an extremely hazardous work environment because social distancing is impossible. There is a lot of contact between inmates and our security personnel.
Oliver says allowing staff and inmates to get the vaccine in this phase will help cut down on the risk.
It would probably help a lot because, again, this is almost like a pressure cooker. I mean, it's like a big petri dish, you know, because there's so many people in close quarters.
A big problem right now is scheduling those appointments. The health department says this phase is seeing 14 to 15 times the amount of calls compared to the first phase, and the hotline couldn't handle the volume. The health department says those kinks are being worked out.